12 Steps has a long track record of working, but with opiates, it's so lethal that that period of time of a year and a half of starting and stopping is so lethal. I think they need, sometimes they need some medical assistance. And unfortunately, it's very similar to that thing that we jumped to when we had chronic pain and we kind of became hysterical and said, well, we got to give everybody opiates and there's proof that it's safe. We're doing that now with the people that are hooked on opiates. Let's give them another opiate, buprenorphine. And there really hasn't been a lot of data to substantiate that. It's kind of shooting from the hip and it's theoretically maybe helpful, but long-term maintenance on young kids, giving them an opiate, which is buprenorphine, imprinting on their brain when it's soft. Adolescent brains are different than adults, and it's not even organized yet, and putting them on long-term opiates like buprenorphine, we don't know what that's doing to the brain. And it looks like you can permanently tattoo a change in the brain that's talking about your personality and your judgment center and everything. So buprenorphine is a helpful drug for detoxing in short term, but it's now being highly promoted to be used on long-term, indefinite use, even on 16-year-olds.
And that seems like another waste of human potential in many ways.
We're going to have big problems 5 years from now for people trying to get off that, because it's really hard to get off that, long-term withdrawals.
Well, addicts tell me it's harder to get off that drug than it is heroin.
Yeah.
They tell me it's harder to detox off that. Yeah. So, Secretary Landgraf, how is the state advancing in the area of treatment and building capacity throughout the state to promote access to treatment? I know it's been a big challenge.
It's been a big challenge, but I think, we were provided additional funding, and I think because of the level of epidemic that this has associated with it, and because of that, we also were looking not only at building our capacity, but also adding a variety of levels of care. First, what we want to be able to promote getting back to that community is building communities that support recovery. Because recovery doesn't necessarily just happen in a place, in a building. Recovery is the rest of your life. And therefore, how do we reinforce through that community infrastructure, which we are all responsible for, to support our loved ones in their recovery. And that's working at a multifaceted way, enhancing not only our treatment, but also working with employers. We know when we have an epidemic, everybody is impacted. So how do we build that level of support in our school systems, promoting sober schools, not only educating and working towards prevention, but also when we know that our students and our children are struggling with addiction, how do we support them to become that healthy brain again and offer them that level of support in coping, whether they're children or adults? How do we address trauma? We know that there's a lot of underlying causes that actually promote people then in seeking other alternatives to deal with that numbing of the pain that might not only just be physical pain, but also if they've experienced trauma. We also know that when people are in active addiction, that also promotes trauma. So we have a lot of circular things that are occurring for that human being that only then reinforces a level of engagement across our entire community. And you brought up, the intersection with law enforcement. It is also critically important that we have a mechanism to look at our data. And when we see clusters of things occurring relative to the law enforcement data, combining that with our public health data, we have Jerry Daly here, who's through HIDA, and Delaware's now part of the Philadelphia, Camden, New Jersey HIDA, and working with the federal government, with our local law enforcement, and again with public health, in a more meaningful way, so that we can actually identify in real time what is occurring. And if we start seeing a lot of criminal activity, looking at our treatment, at the availability of treatment within those same areas. The other thing that you touched upon relative to prescribing, one of the concerns that I always had when we were going in and actually closing down the pill mills, we have no mechanism to support those individuals who are going to the pill mills, who are now left with nothing, and who are suffering from addiction. It's not you close down the pill mills and then we identify all of that patient population so we can wrap around recovery and treatment. So there's some gaps that we still continue to see, but indeed when I look out here and see the number of people, it does give me hope. Because people are now recognizing all hands on deck, and it's going to take all of us to really look at how do we promote health and wellness within our entire state.
Thank you. Sam, I have a question for you.